Hello families, my name is Dr. Claudia and I am a chiropractor who specializes in prenatal and pediatric chiropractic. And I'd like to share with you some questions that sometimes can happen in my practice because it can be unusual for somebody, maybe your friends or family members. Why would you bring your baby or your child to a chiropractor? Well, as chiropractors, we realize there are three causes that can cause stress to the spine. And one is physical, which means there could be falls or tumbles, even birth trauma that can cause strain to the neck, middle back, or lower back. So as chiropractors, what we do is we do an exam of the spine and we do an exam of how it's affecting the nervous system. And so with babies and children, we do palpation as part of the examination that's done at a visit. But somebody might ask a question, aren't babies' bones just too soft? I mean, aren't you going to hurt them? Absolutely not. Babies' bones are like hyaline cartilage, and from hyaline cartilage they go to tough, hard bone as the years go on. And if you think babies were so gentle and like, oh my gosh, could they be hurt with an adjustment? Over 50% of all babies, sorry to say this, moms and dads, you drop them from a couch, changing table, and so forth, and they're very resilient. So trust me, our spine is very resilient, and the chiropractic adjustment is done very specific with our fingertips. Sometimes it's our fifth or our pinky fingers, our second fingers, and we do a light thrusting adjust. So our baby's bones too soft? Absolutely not at all. They have a healthy, sturdy spine. Second question, can kids get addicted to an adjustment? Absolutely not at all. You see, as a chiropractor, what we do is we examine the spine when a child is coming in for a visit to see, first off, do they need to have an adjustment? And then when we deliver that adjustment, we schedule their visits to their needs. Now, moms and dads give us a lot of input because if they've had a fall or trauma, they're going to probably call us a little earlier in to check the spine to make sure that their kids are growing up nice and straight and have the proper curves that they should have as they're growing up. You see, why many parents are thinking about pediatric chiropractic is that maybe as a child you received dental care and boy, your teeth are in health and condition, you've got a wellness mouth basically because of your mom and dad. Well, many young parents who are now in their 20s and 30s and 40s who never got chiropractic care as a child, they got dentistry, they're catching on, wait a moment, I got healthy dentistry care, but I have a horrible spine and how it's affecting my health and well-being. I'm not going to let that happen to my child. And so that's why progressive young parents are bringing their children to see the chiropractor. And so no, not addictive, it's just called wellness. And the last thing was, well, somebody I had heard once say, well, if you adjust kids, they're going to get arthritis of the spine. That is just ridiculous. Absolutely not at all, because we're specific adjusting, and it's just a gentle thrust to make sure that your child's spine is developing nice and straight with the proper curves. Because docs, you know with your patients, and this is patients, you need to know from your docs, there's 3 windows of time, 0 to 5 years of age, 5 to 10, and 10 to 18. And after 18, your spine basically, it's tough to make any changes. So like dentistry, we like to start early and get your child checked by your family wellness chiropractor.